Okay, I am so excited to share another case with you this week. Is this ceramic implant failing? This patient presented in 2020 with symptoms. She had pain in the upper right, intermittent swelling, and she just knew something wasn't right. She had had a root canal procedure. She had already been seen by her local dentist and came to us to have a more definitive answer and definitive treatment. This infection had destroyed a significant portion of the surrounding bone around this tooth, had begun to cause inflammation into her right maxillary sinus, and also was putting the adjacent teeth at risk because of the amount of bony destruction. Here's how gross the tooth looked in the mouth. You can see the discoloration. When the tooth was extracted, this is what it looked like. The orange material is gutta percha, which is basically latex mixed with zinc oxide, barium sulfate, and other plasticizers. In the upper right, that was the size of the cyst. And in this case, you can see it was as large as the tooth. This is chronic inflammation and chronic infection affecting the patient's whole body health. Here is the size of the defect after the tooth was extracted. Sorry for the photo quality. We cleansed the site thoroughly mechanically as well as with ozone. We then placed an SDS 5.4 by 11 ceramic implant. This is zirconia or zirconium dioxide. We surrounded this with platelet-rich fibrin from the patient's own blood. We centrifuged it at 2200 RPMs for about 8 minutes. This is how well the bone regrew after 5 months. So although the image on the left looks concerning with the lack of bone surrounding this implant, as well as even the lack of bone on adjacent teeth, this case went very well. Here's what the soft tissue looked like at 5 months. I was a little concerned about the aesthetics on the cheek side, the buccal, but it did fine. This is where the rubber meets the road. This is so exciting. This is true healing. Bone growth over 4 years. On the left, it looks like a huge defect, and on the right, we see the case today. This was the day of restoration 4 years ago. Soft tissue looks okay, still kind of a big defect. And this is what the case looks like today. 4 years later, we've had healthy, stable soft tissue and amazing bone healing. The patient couldn't be happier, and what a healthy outcome for a really compromised case. I am so happy to share with you today. Thanks for watching. Tune in next time.